Welcome back. November is Prematurity Awareness Month. Now, more than 380,000 babies, so that's 1 in 10, are born prematurely each year, according to the March of Dimes. In the past year, the neonatal intensive care unit at Helen DeVos Children's Hospital admitted more than 1,400 babies from 35 counties across the state of Michigan. Dr. Ed Beaumont, he's the medical director for the NICU. He's here with us today to talk about prematurity awareness and what the NICU does for its littlest patients. Good morning, doctor.
Good morning.
Hey, could you tell us a little bit about the Helen DeVos Children's NICU, the hospital's NICU, and what makes it so special? I mean, it really is top-notch.
Yeah, so we've been here for almost 50 years, and we are the neonatal center in the state of Michigan, one of the largest in the world, really. We currently have between 90 and 100 babies in our unit. So very, very busy, busier than we would like to be. And a very large staff, of course, with highly trained nurses, respiratory therapists, and doctors and nurse practitioners that is required to take care of such a large population.
We definitely want to make sure we lower the number of babies there, doctor. You mentioned that you're busier than you'd like to be. So let's talk about some of the factors that could lead to a risk of prematurity. I mean, is there something that people can do to prevent it?
Sure. So 90% of women in the United States will have a baby at some point in their life. And as you mentioned, 1 in 10 of those pregnancies will end prematurely. So everybody out there either has had a premature baby or knows somebody or their daughter's going to have a premature baby. So it's a big problem. The factors that contribute to it are complex, and it's not necessarily medical things. We know that poor access to medical care during the pregnancy is a major contributor. And of course, poverty, poor access to good health insurance, and even living in a rural location can all add up to that. In addition, there are some medical conditions that can increase the risk of prematurity. Diabetes, high blood pressure, kidney disease, heart disease, having more than one baby, twins, much more frequently are born prematurely than single pregnancies. Overall, all things add up to a huge problem in our country, here in Michigan and in Grand Rapids too. The March of Dimes grades countries, states, and cities on how they're doing. And although we have a very sophisticated and very good healthcare delivery system in West Michigan, our average, we got a big C for how we're doing right now. Other countries that are similar to the United States might surprise you. Afghanistan, Turkey, Somalia, Thailand, places that you would think we would do much, much better than, were as good as they are right now.
Well, it's still wonderful to have such a great care right here in Grand Rapids. It's amazing how you took that from global to national right to our state to tell us how we're doing. How does the NICU work with families from all across this state? I mean, we hear you have some pretty some new tech that helps connect families to their babies when they can't be in the same room.
Yeah, so as you mentioned, we got babies transported by our transport team to our intensive care unit from all over the west side of the state. Average length of stay is 18 days. We have some babies that are with us for months, and so their families can be geographically, quite a ways away. When the babies are admitted, we are able to do video conferencing with the mother who, she just had a baby. She can't be moved from her delivery hospital. So once the baby arrives, we're able to do a live video conference with her to show her how the baby has done during the transport and give her an idea of what our unit looks like a little bit. Just recently, our charts on the babies are now available to parents online. So they can look at our progress notes every day, so they can see how we think the baby's doing that day. They can get lab reports, they can see x-ray reports. So it helps them be in touch with how things are going on a day-to-day basis. And we also have just been given through endowment a number of video cameras that we mount over the baby's incubator or over their bed, and a live stream video can go online to parents and other family members if they're given logins, so they can watch their baby day and night as long as they'd like. So it helps them be there when they can't physically be there.
Absolutely, Dr. Beaumont. We can't thank you so much for the time. Thank you very, very much for taking the time out of your morning. Helen DeVos Children's Hospital, Neonatology, NICU, right there, 3rd floor on Michigan Street. You want more information? Maybe this is something that's affecting someone you know, or maybe you're expecting, and it looks like it might be premature. 616-391-1370. You heard the factors of how that could be. Or go to spectrumhealth.org for more information. Top-notch care right here in West Michigan.